Hi, thank you so much for joining us. Today we're talking about lung cancer screenings as lung cancer continues to be the most fatal type of cancer globally. We're joined by Dr. Archan Shah, who is an interventional pulmonologist at Banner MD Anderson Cancer Center. Thank you so much for being here.
Thank you for having me.
So let's start with this. Who is the right candidate for a lung cancer screening?
It's a great question. So this was established back in 2013 with the USPS task force mentioning that any individual, which got recently modified in 2021, anybody who's in between the ages of 50 to 80 years of age, who is a current smoker or who has quit within the last 15 years and has accumulated more than 20 packets of smoking. How is that calculated? Is essentially we take anybody who smoked 1 pack of cigarettes a day for over 20 years, that equals 20 pack years. If somebody has smoked 2 packs a day for 15 years, that makes them 30 pack years of smoking. So anybody more than or equal to 20 pack years of smoking is a candidate for lung cancer screening.
How important are these screenings and how do they correlate to survival rates?
That's a great question. So screening saves lives, and screening is about doing a test to identify a disease before it starts causing symptoms to an individual from that disease. And the USPS the NLST study back in 2011 showed that lung cancer screening CT scans has a 20% relative risk reduction in mortality. That means a significant number of patients can be identified early enough so that we can help them and prevent dying from the lung cancer.
Now we know that lung cancer is globally the most fatal type of cancer, and here in Arizona, the rates are especially worse. Why is that?
That's a great question. Well, across United States, we are not doing very well with lung cancer screening, with only about 5% of the high-risk population or eligible population undergoing lung cancer screening. In Arizona especially, we are even lower, with only 1.3% of our high-risk population being screened for lung cancer screening, which puts us at as the 48th state in lung cancer screening. It's not that we have less smokers. We actually rank 13th in the nation for the prevalence of adult smokers or those who meet this criteria for lung cancer screening. In order to get more enrollment and encouragement and break up the disparity, USPS task force reduced the risk of lung cancer screeners from 30 pack years to 20 pack years to particularly get more women screened, as well as African American individuals who can benefit from these tests.
That's fantastic information. Dr. Shah, thank you so much. So now that you've heard the criteria, please, if you meet it or you know someone who does, get yourself or them to a primary care doctor who can schedule that screening. Thank you for watching, and we'll see you next time.